Go. Hi, my name is Sam Kiffin. My student number is T00698764, and I'm here with Dr. White, who is my clinical mentor. So today we're going to be looking at Hunter's eyes and ears. We're going to start with his eyes. He has no history of eye problems or ear problems, so we're just doing a general examination of both of his eyes and both of his ears. Okay, so we're going to start here with his menace response. So for his menace response, I'm going to just take my fingers here and I'm going to make sure not to touch his eye and also not to direct a lot of air into his eye and see that he blinks. Because if he doesn't blink or if he doesn't move his eye, we have a problem, but this is a natural reflex that he does blink, which is great. Palpebral response. So that is his palpebral. It's going to be his upper eyelid here. So all I have to do is touch on it. This is something that's often used after anesthetic when a dog's waking up from surgery. Right now you can see that Hunter is able to consciously make the decision to close his eye. If a dog was in surgery and waking up from surgery, until they're conscious, they're not going to be able to decide to open and close their eye. Next on our sheet here, we have pupillary response, direct and indirect. So I'm going to turn the light off for this. Okay, so the light's on. I'm going to shine directly into his pupil to dilate the pupil.
To constrict
The pupil, to constrict his pupil. So you can see that his pupil was much larger and constricted with the light. Now, for the indirect. For the indirect, I'm going to be looking for any corneal damage, any scarring, anything abnormal really with the eye. I'm just looking from the side here. We don't seem to have a lot of inflammation or a lot of blood vessels or anything that seem to be overly dilated. Everything appears to be normal. Turn the light back on. This light's off. Now, we're going to use the ophthalmoscope. We have that right here. I'm going to just turn this on. When I turn it on, the light should come out, which we have here. So, I can turn this off again, and I'm just going to look directly into his cornea. When I'm looking in there, I should not notice a lot of very dilated blood vessels. I'm not noticing anything at all. I'm just seeing that it's pretty shiny and gray back there. Seems totally normal. No abnormalities. Just gonna turn this off. Okay, next we're gonna have the Schirmer tear test. For the Schirmer tear test, I'm going to take one of these strips here. And I'm going to have the technician who's videotaping this for me put the timer to 60 seconds. So once I put this into his eye, she'll start it and we'll see what number we get. So I'm going to place this down into his eye there and go. Stay Hunter. Okay, so the number that I got on this was about a 9, if you can see that there. So that is actually fairly low. Our normal reading is going to be between 15 to 25. Okay, so we're going to cleanse any discharge from his eyes. I can just take some gauze. We have gauze right here. I'm just going to put a little bit of the eye stream on the gauze here. And it's not a lot of discharge. I'm just going to be very gentle and rub underneath his eyes here. I'll do the other one as well. Just gently, you can see that some of that discharge is coming off there. Okay, fluorescein test. So, for the fluorescein test, I'm going to be taking a little bit of the eye stream, and I'll apply a little bit of the eye stream onto the fluorescein strip. And then I'm going to touch his eye with it. Just like that. You can see that there's lots of it there. So, this, I'm going to turn the light off for. And I'm going to take my pen light again. And I'm just going to take a look on his eye here. If there was any cornea damage, you would notice that there was stain that was uptaken by the cornea itself. Instead, we can see that the stain is all just running down the eye into the lacrimal duct here, or the lacrimal puncta here, and eventually that will run from the lacrimal puncta down into the nasolacrimal duct. So I'm going to turn this back on here. So it'll run from the lacrimal duct down into the upper and lower calcaneus, and then it will run all the way down the nasolacrimal duct there. And in between the nasolacrimal duct and the calcaneus is going to be the lacrimal sac. So it will just make its way all the way down here, and you can see it's actually coming out of his nares right now through the process. So for the ophthalmic anesthetic, Dr. White, do you feel like we need to apply any of this to this patient?
No, it's only drop of anesthetic on the eye. If you needed it, we don't need it here.
Okay, the tonometer test. So we can do the tonometer test now. I'm going to take our tonometer. I need to turn the tonometer on. We can see that it's on. I'm going to use Hunter's other eye for this. So then that gave me results of 10. You can see 10 there. That's a little bit on the low side, but it's still okay for Hunter. Hunter has no eye problems, so this tells us it's 10. So again, for the tonometer, I press this button 6 times. It just takes an average over the 6 times. I'm gonna place this back down. And then still drops and or ointment. Okay, I use natural tears. What would you like me to apply into his eye? Okay, so I'm going to take some of this optic scare here and put it into his eye. There we go. And that's just an eye lube. It's not going to hurt him at all. Okay, and we're done with it.